workshop. So coming from a very large hospital system back home and what we're doing there and what we've been doing for years, watching what they've accomplished within a couple of years has been nothing short of amazing. It's been a privilege to work with this team to help innovate and develop their program here. This is going to be one of the centers within this region that will have this unique capabilities, and this workshop's going to today present some of those capabilities and what they are. Expectations with Daninia are very high. And the reason why I say that is because you have a remarkable staff. The support that you're getting from the director, from the community, from your doctors, this is going to, those components, those pieces will accelerate the mission that is being put forth here to the team. So the 3D printer is already here. It's upstairs. We're already using it. They just acquired it. They have 3 different types of printers. One is what we call the J5 by Stratasys. It's one of the high-end printers. It's able to print in multiple materials and colors. We can color code everything. So we've been working over the last year or so to be able to get that technology in-house, because it's not just a printer. There's also support softwares that go along with it. But the goal is, the idea is here, is that we're going to be able to take patient-specific data, CT scans and MRIs. So say someone has a aortic problem, that we'll be able to 3D print an exact replica of the patient's anatomy for the doctors to look at, to help plan surgeries, and also to help educate the patient on what the problem is. So the printer's here, all the technology's here, and what we're doing is building this program up so that physicians have access to it. So we don't know how this is going to affect overall patient care. We do know it does affect it, though. We've seen it in other institutions, such as the one back at home that I work at. If it didn't, we wouldn't have the high volume of printing these different models for surgery. So we know there's an impact. We have yet to done a clinical study to look at outcomes, to look at procedural complications or reduction in procedural complications, and how it affects the patient overall. That's still very young. I mean, 3D printing, even though it's been around a while, but using it in the medical community is something newer, fairly new, and we're still working on how do we put studies together, start measuring those, how it benefits outcomes. But we know it does. There's no doubt about it. I would say that physicians here and also back at home would not be asking for these models if it didn't improve outcomes.